Hello and welcome to the Vibe at Vive. I'm Arundhati Parmar, Editor-in-Chief of MedCity News. Today, I'm joined by Brad Younggren, Chief Medical Officer of 98point6 Technologies, which recently sold its care delivery business and rebranded as a software provider. Health systems can now license the company's cloud-based platform to enhance their virtual and hybrid care offerings. Welcome to you, Brad.
Thank you for having me.
So Transcarent just bought your care delivery business for $100 million. So can you please talk about, the evolution of 98point6 Technologies and where you are today?
Yeah, so we recently announced the sale of the 98point6 care delivery division within 98point6 to Transcarent, which included the standalone virtual clinic that we had built from the ground up over a 7-year period, and including the millions of members who seek care daily, which includes enterprise customers like Boeing, Chipotle, and Banner Aetna. Now 98point6 Technologies will remain solely focused on licensing the care delivery technology itself to health systems such as Multicare Health System, which was the first to license it, and other companies like Transcarent. Our mission is always to provide high quality care, leveraging different aspects of AI systems to improve care delivery. And that journey will just continue for us as we continue to focus on building the software that other health systems and care delivery organizations can use to increase access, improve quality, and lower the cost of care.
So how can you describe in a little more detail how health systems can benefit? If someone's thinking of launching a hybrid care solution and they have not done so in the past, what are some of the steps that you have to walk them through, and what are some of the capabilities you have that can help them?
Yeah, it's really a turnkey cloud-based solution with 7 years of in-house knowledge that we're sort of reflexively providing to our health system partners. It's a standalone digital clinic that is hosted in the cloud. This leverages AI systems, including machine learning techniques and expert system techniques to impact workforce management, patient safety, quality, reduction in variability in practice patterns. All these areas that we really focused on previously are part of what the health systems are getting with their partnership with 98point6 Technologies. We have a web-based clinician console where the operators work out of. That includes APPs, physicians, clinical operations people, MAs, and licensed therapists. All have worked on the platform in the past in some capacity. And so that modularity already exists for health systems to customize and use this software in the way that they see fit best for their use cases that they're most interested in. We have an SDK, so we basically have a capacity to fully brand this with the health system and the way and the fashion which they think is best fitted for their patient population. We have maintained our learning and development and training team. So that's a large team that we built over time to train new operators or humans, clinicians, and otherwise to understand how to effectively use our software. And then as we bring new product releases, that learning and development team is critical for retraining people on how to use new product features that come to exist on the platform. So that group will continue in partnership with our health systems to help train their providers, as an example, how to effectively use the 98point6 Technologies virtual care platform most effectively from a care delivery side, workforce management side, really any angle you may ask, patient engagement side as well. So those are the main areas that we're bringing across to the new company. We're really excited to provide all these 7 years of learnings to our health system partners in the coming years.
And I'm curious, when you are targeting health system partners, is there an ideal size that they need to be to take full advantage of your cloud-based platform, or does any size work?
Really, any size works. We're working with a lot of regional health systems that typically don't have large product and engineering teams inherently built into their own system. So when they're looking at the market and seeing large new players coming in, potentially disintermediating their traditional relationships with their patients, a lot of those organizations actually have their own product engineering and data science team. We're really providing all of that for the health systems that may not have that type of expertise in-house. So we're working in partnership through a health system advisory council to allow those health systems to actually have a voice in product roadmap and product development. The health systems understand what they actually need. they may just not have the capacity to build that. And so
Mhm.
we're going to give them a lot of off-the-shelf technology and then continue to partner with them to build new and innovative technology in the years to come.
So I want to address, the current market landscape. Deep uncertainty in the marketplace. Digital health is being scrutinized like never before. High interest rates, high inflation, and then, of course, earlier this month we had Silicon Valley banks collapse. So I'm curious about your mood. How are you taking all of this?
Well, I think, and I'd say even more broadly, I still have lots of tendrils into the traditional healthcare delivery system. Many friends and partners that I've worked with in some capacity over the last 30 years are working for traditional health systems. And now I'm working with them in this new role in partnership with health systems with 98.6 technologies. And certainly there's a lot of economic impact to health systems directly based on what's going on in the economy. And we're very aware of that as well. What I believe is that, and I think most health systems believe this too, is a digital strategy will be a requirement to survive for the next 10 years. All patients expect some opportunity to interact with healthcare through a digital platform. And we really think, and I believe that this is an opportunity to really lower the cost of care delivery. Virtual care has the best opportunity to increase access in a regional market for patients that traditionally have had difficulty getting that access, while at the same time actually fundamentally lowering cost. So a lot of the principles that drove us to start the company 7 years ago, I think still apply, that to answer the problems and to answer sort of the call of a traditional health system, we're really well situated to provide technology support that they really need. Mm-hmm. They're going to need increased access. They're going to need technology that improves workforce management, optimization, so that they can use the same workforce to see and take care of more patients, as one example, and address issues like provider burnout. One of the really great aspects of spending 7 years building technology for your own clinic was we really kept an eye on provider satisfaction, or how humans liked operating on the technology we're building. So that really kept us honest. And the technology that we use now, I think, is best in class at addressing issues related to how providers use technology and how that could potentially is a risk for increasing burnout, and thus actually reflexively having a better impact in the case of our technology.
Well, good luck on this new journey. And thank you very much for spending some time with us today.
Thank you very much for having me.